My name is Nicole Hindman. I am a diagnostic academic radiologist. In my department at NYU, we have 234 radiologists, and we have people that specialize in almost every aspect. And within those, you can even have a subspecialization. Like, I'm a body radiologist, and my focus is on genitourinary, which is kidneys and reproductive organs. When I was in 11th grade, going into 12th grade, I went and I got a summer internship at NIH. And I worked in the NIDDK, which was diabetes and digestive kidney diseases. And it was a really great exposure. You had patients who had the disease in one part of the hallway, and in the other part, the researchers were working on finding kind of ways and more information about their diseases. And that was really eye-opening for me, because I could see how you can have the clinical effects and the cells that you're working on, and then you see directly the impact that your research is having on a patient. And a lot of the researchers there had MDs. They weren't all MD PhDs or just PhDs. A lot of them were actually medical doctors. And that was when I realized you could do research with an MD. You didn't just have to get a PhD as well. Most people who go to medical school want to help people, and they want direct patient interaction. So you never really think about fields like pathology or radiology or non-patient facing fields. And so when I got in, and neither of my parents was a medical doctor, so I didn't have any idea really of what being a medical doctor would be. When I was rotating through a lot of the wards, I realized that in medicine and surgery, all of the doctors would go down to the radiology reading room and ask these like dark room physicians what they thought. And the radiologist would look at the film and then somehow magically, kind of without ever seeing the patient, tell us what was wrong with the patient. I realized that these brilliant radiologists were solving a lot of the problem that we couldn't solve on the rounds. And I thought, this is crazy. How can you just look at a film and figure out so much about a patient? And I wanted to know more. I took a radiology elective, and I thought, this is amazing. You know, as you do certain things, you realize if you are good at it. So if you're somebody who is very visual and you really do well kind of with looking at things, and when you hear lectures, you kind of do better with like copying drawings and kind of imprinting it on your brain that way. I felt like visually I just clicked with this field. And so when I studied, it was kind of, you recognize disease entities and pattern recognition. And in radiology, how you get really good is they say you put on the retinal miles. So you see things again and again and again and again and again, and you suddenly realize, okay, this is normal. This is the wide variety of normal. So I know that not to scare this patient, because this is within the normal range. And then you can start to pick up what is the wide variety of abnormal, and you start saying, aha, this person I'm worried about, I need to send them for another study. The traditional is 4 years of medical school, and then for radiology, we still require a medical or surgical internship. So 4 + 1 internship, and then it's another 4 years of radiology residency, and then many of us do another 1 year of fellowship. And so it's a long path. So that's like, it's about 13 years of training after college. After med school, you're paid. My residents will say you're barely paid, but you're paid. And then when you are done with your fellowship, you get a job. You can do either private practice or academics. I'm an academic radiologist. So that means, you know, I give talks at national meetings. I publish papers. I work with residents, medical students. on getting papers out and kind of learning how to present at national meetings. And that's kind of the training. I think for me, it's really great when the clinical team or the patient has a question and they have no idea what's going on. And everyone is just waiting for you as a diagnostician to tell them what it is. It's extremely powerful. And, people will say that carries a lot of responsibility with it. And it's true, but it's actually really great to go through a film, kind of systematically look at what is going on, piecing together your knowledge of anatomy and your knowledge of disease processes and courses, looking at the clinical picture, the labs, which is kind of what we learned during our internship and medical training, and then putting it together with what we see on the image, and then saying, you know what, this is the most likely diagnosis. I think there's a lot of misconceptions over how you can balance your work and your life and having a family. When I was in med school, I was like, oh, you know what, I don't think I want to be a surgeon. I don't think I can balance that lifestyle with, raising a family and being present. And I'll tell you, a lot of surgeons have better hours than I do, like now. And you won't know about the field until you're actually in it. And what's interesting about that is, what my dad told me, he said, do what you love and you'll figure it out. Because everyone figures it out. Just, don't worry. And it's the same. People will say, don't have a kid while you're in med school. Lots of people now have kids in med school. People will say, don't do this field. Don't do plastic surgery. Don't do orthopedic surgery. You'll never be able to have a family. And it's not true at all. You can do any field and you can make it work. And you'd be surprised at how reasonable once you get out of, even it's only like usually 2 or 3 years of training that are really tough. And in your chief year in surgery, it can get a little bit better, more reasonable. And, then it gets to be kind of something you can balance and negotiate in your contracts. I'm an academic radiologist. So the way my group works is we cover many different sites and we cover a number of places by teleradiology. So I'm at NYU, which is based in Manhattan, and there's a number of offices in Manhattan, but then there's also coverage that we do for Brooklyn, Staten Island, Long Island, Bronx, different sites throughout Chinatown we cover. So in order to cover all these sites, we have different requirements each day. One is like on Thursday, I have to cover a 7 a.m. interdisciplinary conference for surgery where I review all of the scans ahead of time, and then I essentially go over those scans for the surgical department during their weekly morbidity and mortality conference, where they kind of go over issues that relate to patient care. Most of us in my department cover 1 or 2 interdisciplinary conferences a week, and usually those are at 7 a.m. in the morning. They're super exciting, very fun to learn from, but they are early. And then after that, I have to cover my clinical workflow for the day, which for most radiologists, we sit in a room and we read about, I'd say on an average day, you read about 30 CTs. You may have a bunch of ultrasounds that you're reading as well. And then we tend to separate our MRI days into different workflow, but on average, I'll read maybe 30 to 40 MRIs in a day. And some of our busier radiologists read like 60 CTs in a day. That's very high for me. And I have residents that often are sitting with me or fellows, and so I'm teaching them as I'm going through the studies. And my day typically ends around 5:30 or 6 o'clock at night, and then I go back home. Now that's one of my days. One of my other days that I have is kind of more set, where I may come in around 8:30 or 9 if I'm on an academic kind of day, and I can write papers. I do a number of projects with other clinicians, and essentially reach out to the statistician. I review images and I submit images for publication and papers for publication. And I also kind of will review papers. I sit on the editorial board of a number of our journals, and I go over those as well. And on those days, I also prepare talks to give at national meetings, and I kind of will get those ready. And I do a number of educational courses. Those are kind of my different days. Communication is a really important skill. Being a good communicator and understanding and empathizing with the patients that are having their scan and with the doctors that are ordering the scan is great. And I think when you are kind of disconnected, you realize that it's really hard to be a frontline physician who's facing a very anxious patient and someone who's scared about their results, and being quick in your turnaround and giving them a definitive report that they can use is super helpful, and expressing it clearly. And so that's kind of, radiology has evolved into now structured reports, which means when you give your report, it has fill-in fields and you're supposed to use certain language so that your communication and what you want to happen is not ambiguous. And so that's kind of been the trend in radiology now, and it's kind of being very definitive and being very clear. So I would say communication, which goes along with writing very well, learning kind of how to make sure that you are being kind. A lot of times as a radiologist, I get interrupted constantly in the day. So you'll be reading a film and suddenly your phone rings because someone wants you to read a different film fast for them, right like that. And so I'll be in the middle of thinking through like a pancreatic cancer, and I'll be in the middle of a 2-page dictation on how it's encasing certain arteries and vessels. And I was trying to figure out if there was a metastasis to the liver or if it was actually resectable. And now I've got a phone call that interrupts me, and I completely forget my train of thought. And I have to be nice and be kind to the person calling me, help them out, and then go back and start my dictation over, trying to put myself back where I was. And that happens all day long. So if you can have good patience and self-control and kind of keep your cool, that's also a good trait to have. In the field of radiology, there's so many wonderful advances that are coming down the pipeline. For example, in my office building I'm in today, I work a lot with the physicists that do the MRI scans, and they develop coils and advanced coil technology for the magnets. We also have dual energy CT physicists that work on the physics behind the dual energy CT scanners, and there are a lot of collaborative projects you can do there. In terms of artificial intelligence, like trying to use certain computer programs to spot findings and to try and figure out ways to make radiologists better at what we do. And in the past, even though people said teleradiology would hurt our field, it actually has helped it, especially during the pandemic. It allows us to provide more help to places that are less reachable. AI, often the computer-assisted detection, has helped mammographers pick up more cancers. It's helped chest radiologists pick up more cancers, but usually it always performs better in conjunction with a radiologist and not in isolation. I think that that's a definite benefit of the kind of working together and not taking a nihilistic approach to these new technologies and feeling threatened. It's more welcoming them and welcoming the opportunities they give. I know all of you young people are so hyper-focused on achievement and achieving early and staying on these straight path lines, but I would say roads are never completely cut off to you. A lot of my colleagues had other careers. Like I worked with one of my residents was a Alaskan fisherman. One of the radiologists was a Olympiad fencer. One of the other kind of people I worked with was an artist, and they did that career, and then they came back to medicine and applied after a break. I would warn about shadowing a radiologist before you've had the requisite training, because it will probably turn you off from radiology. Because like I said before, you're in a dark room, they're reading very quickly, you won't see what's going on, and you'll think, this is boring. But honestly, if you Google even just American College of Radiology resources for residents, if you Google like any RSNA, which is the Radiology Society of North America, our main society, and look at just resources for patients or residents, medical students section, those actually oftentimes are accessible to high school students, and it'll give you a good idea kind of about the field.